Hello, Trigger, and welcome to another exciting episode of the Learn True Health podcast. This episode is, for me, it was more intense than other episodes that I publish because the message, I so desperately want the world to hear this. So keep an open mind. Please share this with your loved ones. This information needs to get out there so we do not repeat the mistakes of our past. We dive down some really uncomfortable truths, some whistleblower information, expose some blatant lies that we've been told in the last 5 years in the media. And I think it's so important that we know the complete story, that we know the full truth. In the interview, because I completed this interview before the new year, I say the last 4 years. You'll hear me say that a few times. And when I say that, what I mean is during the active COVID pandemic. It is now 2025, so it's technically, in a month, it's going to be 5 years since the COVID pandemic we were actively in it. It's funny, though, I had sort of almost like an amnesia when it came to identifying, has it been 4 years? Has it been 3 years? Has it been 5 years? And I think we all feel a little off kilter because we all sort of have this PTSD around the last few years of wanting to just move on and not wanting to remember how much fear we were being fed and how much concern we had for our loved ones and how many families were divided. I certainly know many of my friends and family have sadly possibly permanent damage to their relationships in their friend circles and their family because the decision to get a brand new vaccine that was largely untested divided the nation, divided the people. But now that we have the full data, we can look back and we can see, did we make the right choice? And who is suffering now for making the wrong choice? And I ask that you hold those people in your life who are injured now from making the wrong choice. Just hold them in love. And this isn't a I told you so, because we didn't want this on anyone. But I hope that those who were angry at us for choosing not to partake in the national experiment, that you can let go of your hate and anger and that we can have love in our relationships again. And we can all agree that it was a time when we all thought we were making the best choices for ourselves based on the information we had. And that it's okay that we possibly made different choices. It's okay because we're making the best choices we could with the information we had. So today's interview, it's wonderful information. My jaw was on the floor. I know your jaw will be on the floor too. So just again, keep an open mind and listen and please, by all means, research this information yourself. I never ask anyone to blindly believe anything they learn anywhere on my podcast or anywhere, right? We should always dive in deeper. But wherever you get your information from, just make sure that the organization that's putting it out doesn't have an ulterior motive, isn't funded. Like, for example, the CDC profits from the sale of certain vaccines that they've created. How can we trust an organization that profits from something to tell us it's safe? Isn't that bonkers? And if you go down that rabbit hole, because I did, at first Google is going to tell you, no, the CDC does not profit from this at all. You're wrong. It's a conspiracy theory. It's an anti-vaxxer rhetoric. And if you dig a little deeper, just spend 10 more minutes diving deeper, you'll find that, yes, there are royalties, there are gifts, there's certain funding, and we just have to remember that there's cover-ups, there's whistleblowers, there's people coming out of the CDC saying that it's trying to protect its own hide, that the people, the scientists, have made some unfortunate choices to withhold safety information to protect their jobs, maybe to protect the royalties they're earning. So people within the CDC earn up to $150,000 a year in royalties from the vaccines that they license. So there's license fees. So there's lots of shenanigans going on. You have to look deeper. Question everything. Shouldn't we question everything? Is there really a time when we should just blindly allow a company or an agency to dictate our health choices? Let's take a step back. And this reminds me of when my friend had cancer and we watched the original The Truth About Cancer series. If you haven't heard of it, totally recommend watching it. It's a 7 or 9 day. They've done several. They've done like 3 or 4 seasons of this where it's 7 to 9 hours is a season. Hours. So like think of 9 hours of watching whistleblower after doctor after expert talk about how they've helped people to heal their cancer naturally. And you also hear from cancer survivors who talk about it. And everyone says the moment you get this diagnosis, the hospital system will try to rush you as quickly as they can to get that port put in, to get that surgery, to get that chemo, to get that radiation. You're on this conveyor belt that's going 1,000,000 miles an hour, and there's no time. They don't want you to have any time to stop and think or take a breath or get a second opinion. And I watched this documentary series, and they said this so many times. So many different people said this. And this was when my friend was newly diagnosed. And then I went with her to her appointments, and everything they said happened. Every single oncologist she met with, and she chose to meet with 3 different oncologists from 3 different organizations. If you get a second opinion, you never go to the same clinic or the same group. Like if it's a university that has a bunch of clinics, you don't go to just a different clinic. You have to go outside of the organization or hospital system, finding 3 separate people in 3 separate organizations or independent doctors. And everyone did the same thing. They tried to okay, we're going to get you in on Tuesday. We're going to, by Thursday, we're going to have your breast cut off. And by next Sunday, we're going to have radiation. Like it was just like boom, boom, boom. And we would always ask, is it okay? Wait, hold on. Can we just take a moment? Can we pause? Like, what's the harm in, waiting a week and thinking about it and making a plan? And you'd see the frustration on the oncologist's face. And it was a sales tactic. It's a disgusting sales tactic. It's not saving lives to rush someone immediately in for chemo. Waiting 1 week isn't going to make the difference between life and death, and allowing them to breathe, process, get some second opinions, and research. God forbid, if we all researched this information, we would begin to see the wizard behind the curtain. We'd begin to see the flaws in the system. And this is just how I feel the last 5 years, is this concept just like rushing us through. Well, this vaccine wasn't tested, and then the way they did the hospital protocols were, and everything was designed to keep us in fight or flight, keep us not learning, not researching, not questioning. And then if we did question, we were attacked. We were attacked verbally, emotionally, and ostracized. And it was all very weird. It felt like a psyop. So that my feeling is we need to learn from the last 5 years before we put it to bed. We need to fully learn from it, or else we are doomed to repeat the mistakes of our past. So this interview, hopefully, for you, it was very cathartic for me. Hopefully for you, it will be incredibly cathartic and will allow you to process the last 5 years. But between 2020 2020 and 2024, let's say, will allow you to process it. And although this is evergreen content, you might be listening to this 10 years from now and be like, oh yeah, I remember that back in 2020. Here's the thing. Even if you weren't fully immersed in the craziness like I was and like many of us were, we have to learn from it. So take this information in. Definitely watch the documentary that we're talking about. Check out the information. Even if you wholeheartedly do not believe anything, it's still worth taking in the information. I have a friend who's on the opposite side of the political spectrum than I am. And we've agreed that instead of just putting up our talons and just the second we disagree, it's, like the media wants us to fight, right? Instead, we try to understand the other person's perspective without trying to change their mind. I don't think I'll change her mind. She's definitely not going to change my mind, but I'd like to have an understanding of where she's coming from and be able to put myself in her shoes and see it through her eyes. Because if we could at least do that, like if I could as a Christian, if I can understand a Muslim's thinking, a Jew's thinking, a Buddhist thinking, if I can understand their world, I'm not going to change my conviction, but at least I won't have the ignorance to mistreat them, to misunderstand them. At least I can fully embrace them. So take this information in, whether you agree with it or not. It's a beautiful thought exercise and a heart exercise in expanding your ability to understand those around you. And if you take anything away from this that has helped you, please share with me. Come to the Learn True Health Facebook group and share with me, or you can email me, support@learntruehealth.com. I'd love to hear from you. Thank you so much for being a listener. And really, thank you so much for sharing this episode. If enough of us learn from the past, we will not repeat it. Have yourself a fantastic rest of your day. Welcome to the Learn True Health podcast. I'm your host, Ashley James. This is episode 539. I am so excited for today's guests. We have on the show with us Dr. Brian Hooker, and back on the show, Polly Tommey. Thank you for coming back. You were in episode 403. And before we get into it, I want to let listeners know I have a list of episodes that are worth checking out that relate to what we're going to talk about today. Back in 2020, when the craziness started, when we were being lied to from every direction, from every agency, I began interviewing people about what was going on. And the documentary we're going to talk about today, I'm going to get emotional because it was so good. You guys did such a good job. And everyone needs to see this documentary. Every single person needs to watch your documentary. I can't believe I learned things watching it. I was actually really surprised because I've followed this really closely the last, being in the holistic health space. I've followed the travesty and the lies and the corruption from the media and from the government and from everything you covered on your documentary. And I can't believe how much I learned from your documentary, but so much that I know what I felt happened in the documentary is I felt heard. I felt that people will feel heard and people won't feel so alone, because so many people were isolated and felt like they were like, oh, this is normal, or they're an outlier, and they weren't. We were all being poisoned or lied to, and so many of us lost our loved ones because of the lies. And so your documentary uncovers it in a beautiful way that I think is very cathartic. But also, if we do not pull our heads out of the sand and we do not learn from last 4 years, we are doomed to continue to repeat the travesties, because these organizations will continue to repeat what they did. So we have to educate ourselves. And there were people that you interviewed in the documentary that that actually recognized that and that got out in time, and they survived. And I love that you covered what you covered. I had Dr. Judy Mikovits on the show, episode 436. Dr. David Brownstein, episode 462. Scott Shigara, which was amazing. I loved that he was in your documentary. He came on and told his whole story, very detailed story, episode 479. Dr. Jane Ruby, episode 468. And Dr. Richard Fleming, which is definitely a must listen to, episode 463. A lot of us have PTSD. I think everyone actually as a nation has PTSD from the last 4 years. And a lot of us just want to, now that we're back to quote unquote normal, we just want to forget that it happened. But doing so, we will be doomed to repeat it. And that's why we have to watch your documentary and we have to learn from the last 4 years. Thank you so much for coming on the show.
Thank you for having us.
Yeah, absolutely. My friend, by the way, she was in your bus the very first time you did the very first Vaxxed documentary. Leah, I don't know if you remember, she was very, very, very pregnant woman named Leah, and she told me to say hi to you. I've watched all three of your Vaxxed documentaries, and all three are very different and very worth watching. And you go deep and you cover the people's stories, and like it says on your poster, embark on a journey to discover the truth. And that's what I feel we did, especially in this last one. Tell us about the journey of going on the road and covering the truth. You, like me, saw the travesties, but at what point, what sparked you guys to want to go out and begin filming again?
Well, at Children's Health Defense during the pandemic, our job is to break down the news and bring the truth to the people, because we all know mainstream media news really does not tell you the truth. And so we were watching what was happening, and we were being told that the COVID shots were safe and effective, that remdesivir was amazing. And we were watching also on social media reports of people falling down, just dying suddenly. And nothing added up. And especially when they started saying that the unvaccinated were the problem, the pandemic of the unvaccinated, that the unvaccinated were killing granny and clogging up the hospitals. We knew the only way to find the truth of what really happened was to get back out on the road and see for ourselves, because we saw that from the last bus. That's how we learned about that there is no such thing as a safe and effective vaccine. The people told us. So we knew, again, the people would tell us the truth, and indeed they did. So that was the inspiration behind it. And we're so grateful to Children's Health Defense for funding a bus, and it was not cheap for us to go out. I mean, that big bus, that 42-foot bus, that cost a lot of money in gas. But the people donated, and they carried us around just like they did the last time. It's what I call a God thing for sure.
I prayed before this interview because I just, standing in my kitchen crying, thinking about your documentary, I'm like, I don't know how I'm going to do this interview. It's not me. And I asked God, please guide me, because it's so important. This interview is so important because we have to, first of all, honor those people who were killed, not by COVID. I know very few people passed away from COVID. People died because of what they were doing in the hospitals. And I love that you guys so well laid that out in the documentary, what they did in the hospitals. And also, I know so many people who, like, I lost a best friend. She had a stroke so bad after she got the shot. And she was my maid of honor at my wedding, and I lost her. I'm sorry. I want to honor these people, and I want to honor the families that are listening. And so I just prayed, please God guide me in this interview, because we have to get this information out there to honor those people. And you know, I made a friend recently, and I know she's listening to this episode. And her daughter, she listened, she believed everything the medical doctors said. She believed everything, because why wouldn't you? We trust these organizations. And she took her daughter and got the shot. And her daughter spent a month in the hospital having seizures, having these crazy symptoms. And the hospital never once said it was a vaccine injury. I had to point it out. I'm like, this is a vaccine injury. She gets the shot and immediately develops. she has seizures so bad, so scary, and she's still to this day affected, and that's just one child. Think about all the children who are having these horrible, possibly for the rest of their life, symptoms, and all the children that died, heart disease and children. I haven't even let you talk, Dr. Brian Hooker. Tell us about the statistics after these children started to get, and these young adults and teenagers started to get the COVID shots.
Well, it's absolutely incredible. Now that you mention it, we're one of the things that we get to do at Children's Health Defense is to encounter whistleblowers and anonymous informants and we are fortunate to have several informants that have been following these clinical trials that are really, still ongoing. Even though the Pfizer vaccine was approved, and then also approved under emergency use authorization, and the Moderna vaccine, same thing. But it turns out that 1 in 4 individuals that were in the Moderna clinical trial have experienced and reported a severe adverse event. So that's fully 25% of the population has shown a severe adverse event to that particular vaccine. And it's not, me just saying that, it's actually the clinical records that bear out, that show, this is not rare. We were lied to. We were told that the vaccine was safe, that it was effective, and it's neither. And so, when you look at this, when you look at the incidence increasing, those adolescents, especially adolescent males that got the COVID shot, then were 25 times more likely to be diagnosed with myocarditis. And myocarditis is not, a benign illness. In fact, it seemed like the powers that be, as soon as this fact came out about the shots causing myocarditis, they started to try to normalize it. Mm-hmm. But the mortality for myocarditis diagnoses, those patients who are diagnosed with myocarditis, is 50% within 5 years. So that basically means that your odds of living 5 years after a myocarditis diagnosis is about half, about 50%.
Okay, so wait, let's back up. So if 1,000 young men, I've heard like as early as age 6.
Yes.
And so taking your kindergartner or first grader in for a COVID shot.
Right.
And then all the way up to, teenage years. And so, okay, so we're taking young men. So let's say we take 1,000 young men in for the shot. How many out of that 1,000 develop myocarditis?
Well, out of that, then, the numbers are not firm for myocarditis, but out of that 1,000, then at least 40 will have some type of cardiac damage.
And out of that, so if you're saying out of that 40,
right.
So if it's 40 people with myocarditis, 20 of them are going to die in the next 5 years.
20 will die in the next 5 years. Absolutely. Yeah. So this is, we're talking about very, very strong, significant effects, and that are being dismissed. Deaths, if you look at the databases that report deaths in the United States, the CDC has what's called the Vaccine Adverse Event Reporting System. There have been over 20,000 deaths that are reported, and we know that database is probably about 1% reporting. And so and there have been other estimates in the United States of upwards to 1 million individuals dying because they got the COVID shot.
So there's people listening that have never heard of VAERS. I really think it's important that we make sure we understand this point.
Right.
So explain exactly what it is. So someone comes into their doctor's office and they get any kind of vaccine.
Right.
Right. So a flu shot, some kind of booster, or the COVID shot, and they experience an adverse event. What is
Correct.
that? What does it look like? Like, oh, my arm hurt for a few days. No, what is it? An adverse event that people would then go to this reporting agency And just to kind of explain it for those who've never heard of VAERS.
Sure. It could be a mild adverse event like a shoulder injury. That happens quite often. To anything to death. And so there's really sort of a whole gamut of types of injuries that are reported on VAERS. Now, the practitioner, if in a perfect world, the practitioner, once they diagnose a vaccine injury, they are supposed to report to VAERS directly. They file a report. It takes about 30 minutes for them to file an online report to VAERS, and then the VAERS personnel will follow up. Well, most practitioners won't do that. My son sustained a vaccine injury, and our practitioner refused to submit a VAERS report. And so we ended up doing it ourselves. So, the parents of the injured party. But so few practitioners actually use that system that about 1% of all vaccine injuries are captured in that system. So for every reported injury, you can pretty much confidently predict that there's 100 more for that, compared to that one report.
So that's the important point.
Yes.
Is that only 1% of people report? Why is that? Now, I have heard that it takes a doctor. If a doctor were to take the time, we know doctors don't have time. They
Right.
barely see you for 15 minutes. In order for their practice to be profitable, they have to have their books full of appointments, one after the other. And the nurses handle the dirty work, like injecting people with stuff or
Right.
drawing blood, right? The doctor just comes in afterwards and comes and goes in less than 15 minutes and then has to go to this next appointment. So it's really it's just like a factory farm. The doctor hardly
Exactly.
gets to know you as a person. They barely look up from your file or their prescription pad. And how long does it take a doctor to fill out? So if they have a child who, this is one of my friends, he was just over a year old. He was walking.
Right.
He was making eye contact. He was a healthy boy who was, just coming into that toddler age of walking. Came into his wellness check. I am making air quotes. Got injected with what they inject children, and this is back in 2008. So not the COVID shot.
Right.
He stopped making eye contact. Stopped walking. He stopped.
Wow.
He just reverted back to, like, in terms of developmental leaps, a 3-month-old couldn't sit up anymore, and so that, would you say, is an adverse event, right? You can clearly see that now he's not having seizures that they can tell. He's not having anything outward, but he went from walking and making eye contact to now he's like a floppy baby. There's something wrong.
Right.
Would you say that that's something that they'd report to VAERS?
Yes, that would be appropriate to report to VAERS directly.
Okay, and how long does it take a doctor to sit down and fill out the form online to report to VAERS?
Approximately 30 minutes, but if they've vaccinated over 20 individuals, then they could have as many as 3 or 4 VAERS reports at the end of the day that they need to file if they're actually doing their jobs.
And that's unfathomable. So a pediatrician just does not have the capacity to sit down and report to VAERS all
No.
of the adverse vaccine events that occur.
No.
Now, you said you sat down. Is that because you're a doctor, or can parents sit down and report to VAERS on their own?
Parents can report to VAERS directly on their own. In fact, we've talked to many COVID-19 vaccine injury survivors who have reported to VAERS on their own. And there was such an overwhelming amount of individuals that were filing VAERS reports that it actually got backlogged. And now we're seeing the phenomenon that people will file a VAERS report, and then all of a sudden their report will disappear online. It will never make the light of day.
Who runs the VAERS?
The Centers for Disease Control in the United States runs VAERS and has a whole division that is associated with not only tabulating, taking the vaccine injury data, but then surveilling VAERS to make sure that vaccines are quote unquote safe and effective.
And tell me about how you've seen the reports dropping off VAERS? Is it because the CDC is doing their job just cleaning up bogus ones, or are they sweeping this under the rug and trying to cover up how dangerous the COVID vaccine is?
I really believe it's the latter, that they're covering up the dangers associated with the COVID-19 shot. Because if you look at, we've done audits of the VAERS system along with an organization called React 19. And what we'll find is that the proportion of severe adverse events that never make the light of day on VAERS, we'll know people who have submitted the report, they get a temporary ID, and then when their report never sees the light of day, it's not the minor reports that aren't being shared with the public. It's the debilitating paralysis, Guillain-Barré syndrome, Bell's palsy, even deaths that are never seeing the light of days on the VAERS report. So somebody is curating them and actually culling out serious reports.
So many parents do not know that VAERS exists. And
Right.
this is something that I pointed out to my friend, whose daughter was in the Children's Hospital here in Seattle, and she ended up taking her daughter to other hospitals to try to figure out other really well-respected children's hospitals around the United States to try to help her daughter, and none of them were willing to say it was vaccine injury. And that she felt that was odd, and none of them were willing to get to the root cause.
No.
And this is that she didn't know about VAERS, and she's very intelligent, and she has her very, very good education background. We just don't know. We don't know as parents. But you were the scientific advisor for this documentary.
Correct.
Tell us a bit about that. How did you play a role in advising I'm sure as you guided them through the questions they wanted to answer, the people they wanted to interview, tell us about that, and through the editing process to make sure that of course they were being accurate and
Right.
well-rounded in telling this story.
Exactly. Well, part of my job was actually to listen to the reports, first of all, as Polly and the team was out on the road. And one of the things that was really shocking to me, and the president of Children's Health Defense, Mary Holland, and myself both cautioned her, because she said they are, she started talking about the hospital protocols and how they were targeting the unvaccinated in the hospital protocols, and they were getting the worst of the worst treatment. And and when these reports came out, when they came back from Polly, we're like, whoa, wait a minute, let's don't rush to judgment. It was very, very hard to believe. But when you take all of these anecdotes, all the stories, all the individual reports that were reviewed, that were vetted, that would say the same thing over and over again. My loved one was taken to the hospital. They were asked their vaccination status. No, I'm not vaccinated. They were treated poorly. They were given remdesivir, sometimes without their knowledge, and also sometimes without their consent. In fact, they would express consent not to use remdesivir, and they would end up, the hospital would say, no, that's our standard protocol, you will take remdesivir. Or they would find out later on, after the patient had deceased, that they were on remdesivir. Then they would be put on a supplemental oxygen. Remdesivir would cause the lungs to fill up with fluid. Then they would be put on mechanical ventilation to force the fluid out, and ultimately they would go into the ICU, and then they would die. And this story popped up over and over and over again, and it's something that you don't want to believe in your most worst nightmare. But it was, I went out on the bus. I was on the bus for about 6 days in total, several different trips. And you would hear this story all the time, and it would end up with a loved one being deceased, or in the case of one of the stories that was highlighted, a patient leaving at the bequest of the family against hospital orders.
I love that story. I love that you outlined that in the documentary. I was so proud of them that the husband went and got oxygen and
Right.
he was and but Polly, when you were there hearing this story, I mean, your jaw must have been on the floor because in the documentary they talk about how they had to get the police to come and help them escape the hospital. The hospital was holding her hostage, was holding her prisoner.
Yeah, I mean, she wasn't the only story. I mean, that one was chosen for the documentary, but we had a fair few of people who were either rescued or managed to get out. I mean, when I say a fair few, maybe 10 out of the 1,300 stories that we did. And it was wonderful. It was almost very emotional when they would come onto the bus and say, "I survived hospital protocol." I'd find myself feeling very emotional because everybody else that I'd interviewed, I was looking at a photograph of someone that had not made it, and it was like an honor to be speaking to these people because they are the voices of what really happened in there. So for all those that were killed. So yeah, it was amazing to see. But those many, many, many. I mean, they killed so many. We only touched a tiny part of this. We're still taking the stories, and they're still coming in, and they're still all saying exactly the same thing. They did not take the COVID shot, and they had a terrible time of abuse in there, and they died a pretty barbaric death. It's just awful.
In the documentary, it's really there's two parts to it. One is talking about the vaccine injury. Well, I love how you start by showing that in the media what they were really doing was that they were using this fear mongering and disinformation to motivate people to take the shot. And oh, it's safe, it's safe. And then, not they withheld. We see how much the Pfizer, for example, withheld how many animals got killed during the trials and how many people died during the trials. It's really scary. Brian, do you remember those numbers?
I do. Pfizer wanted the record sealed for 76 years. For
That's
the clinical
disgusting.
trial information and clinical trial data. And then when the information poured out for post-market surveillance, those deaths that were reported to Pfizer, which are just really a fraction of the total deaths associated with the vaccine, within less than 3 months, Pfizer had reported 1,223 deaths alone from their vaccine alone. That's not all deaths associated with COVID shots. That was only with the Pfizer BioNTech vaccine. And so, and this was a mere, 2 months and change after the FDA had approved this under emergency use authorization. Now, in 1976, when the swine flu vaccine killed 26 people, it was taken off the market directly. But here we have a Pfizer vaccine with thousands, over 1,000 individuals that had died, mere, 2.5, 3 months after the vaccine had been introduced. But, crickets. It was like society was going to take it on the chin.
Well, so and I think and I'm going to play the devil's advocate here, but
Sure.
I think the people who haven't been awake to this information would think, well, the hospitals were just doing the best they could, and remdesivir was supposed to help them. And weren't these people really sick? The people who were infected with COVID, weren't they so sick they had to go to the hospital? And they died from COVID. They didn't die because the hospital procedures. And then in the same sort of way of thinking, well, the people who died from the COVID vaccines, didn't they just probably die from COVID, or couldn't they have died from something else? And how do we know for sure that this shot really is hurting people? And is it at least helping some people? Isn't it preventing people from, because COVID is so deadly, right? Like, this is what we were told over and over again. So
Right.
can you kind of help people who they're open-minded enough to listening to you?
Right.
But we have, and it's and I give them credit for being here and listening. We were bombarded with George Orwellian level PR
Right.
for the last 4 years. And I mean, we've been bombarded before the last 4 years, but the last 4 years, they really ramped it up. And if you're trained linguistically, you could hear just how much they were manipulating us. And so, I have family members who they just believe whatever's on CNN, whatever's on NBC, whatever they say, they believe. And because we were raised to trust that little box and everything that comes out of it, just trust, and it's audacious to think an entire organization, like the government wouldn't do this to us. These big organizations, they're here to protect us. Those are individuals. Those aren't evil people. Our doctor isn't evil, right? So it's so hard. It's so hard to, it's like coming out of the Matrix. It's so hard for people, some people, to even acknowledge these facts. But you do it in a really beautiful way in the documentary. That's why I think everyone should watch the documentary, because it shows like, hey, there's stuff that they don't want you to see. But what we know now, it's because it's coming out now, the vaccines never worked.
Right.
And in fact, people who got them are way sicker, are way more. It caused the immune system to not be able to fight off other infections.
Correct. There's so much evidence showing that the vaccines really did nothing but to suppress the innate immune system. And when you suppress the innate immune system, not only do you make that patient more susceptible to respiratory infections, including COVID-19, other types of infections, including gastrointestinal infections, ear infections, but you also limit their ability to do surveillance against certain cancers. And so, we've seen so many resurgence of so many different cancers in these vaccinated patients. Patients who were in remission before they received the vaccine then came out of remission with a very, very rapidly growing tumor. There have been reports of cancers that usually take years to develop that are now developing over weeks. And, these reports keep coming out over and over and over again. And the more that we look at the components of the COVID-19 shots, the more it's making sense, because there are multiple ways that the way that the mRNA shots were formulated, that you suppress the innate immune system. And even COVID, the Cleveland Clinic came out with a study that showed that if you had received 3 or more boosters against COVID-19, your likelihood of getting a COVID diagnosis, of being infected with COVID, was about 3.5 times greater than somebody who had never been vaccinated in the first place. And so we knew that we were being told lie after lie. We were told that the vaccine would stop infection. We were told that the vaccine would stop transmission. That was a big lie. Even Deborah Birx and Anthony Fauci came later and confessed that it was not effective in preventing infection, that it did not prevent transmission. But yet it's still, here we are 4 years later, and it's still being peddled as the best protection against COVID-19.
So it increases your chances of getting an infection, getting COVID.
Yes.
Which, like, where's COVID now? It's like a common cold. It's like, and we've had coronaviruses before. It's a type of virus, right?
Right. It's a upper respiratory virus. Generally, it causes cold, sniffles, sore throat, malaise. It can cause fever. But this is a coronavirus is not something that's new to society. And if you follow the trajectory of this type of, it's what's called a segmented RNA virus. Usually they mutate themselves out of existence.
Oh, that's so interesting. So you guys followed, you went around the United States in the bus and you interviewed people. Polly, how did you organize this? Like, because I know people are going to think, oh, well, just those, and I hate this term, but those anti-vaxxers are going to be the ones to come on the bus. And of course, they're just going to get a bunch of anti-vaxxers and I really dislike that term, because it is part of that Orwellian languaging. It's if you look into the linguistics, it is to discredit and to stop people from questioning. And that's why I love that what you do, Polly, is to help people to continue to listen and question and be aware of what's going on. So how did you organize all this, and how did you attract people to come and tell their story on camera?
Well, first of all, let's address the anti-vaxxer thing. I think that's a good thing to do because first, you can't call any of us anti-vaxxers because we all took a shot or we gave our children shots, and we're only here because we vaccinated. So I hardly think an anti-vaxxer is an appropriate term for someone who has an injury. So again, it's almost like that's a sort of swear word that you throw at people that you can't argue back with.
Exactly.
So it's offensive because I won't let them get away with that.
Yes, me too. I hate that term. Yes, and I point it out and I say, you're using hate speech. I'm going to use their terms right back on them. It is a microaggression, but it's seriously, it stops people from being intelligent. If you use the word, Nazi or racist, you're stopping any kind of intelligent conversation after using that word. When what we want to do is we want to question and we want to explore and we want to expose. So I'm sorry I interrupted, but I am right there with you with that term.
Well, we call ourselves ex-vaxxers because now that we know better, we do better. So we set out on a tour. What we did was we had, actually my daughter was the tour organizer because she organized the first tour. So we roped her back in to do it again because she knows somebody. And what she would do is contact a local area, say Austin, and say, go to maybe Texas for Vaccine Choice and say, look, the bus is coming here. If there's anyone that's got a story or anything at all, good or bad, we also want to hear from you. If you got measles and your family member died, we want that story is as important as the person who took the MMR and their child died. So, but we can't find anyone who died of measles or knows anyone that died of measles. But anyway, going back to the bus, yes, we would turn up. We didn't know the majority of the people. Many people who came to the bus had never heard of Children's Health Defense. They had just heard that there was this bus that was going to be recording stories of injury and death during the COVID. And wasn't just COVID, we were also looking at the approved shots as well and what happened. So it was all of those that came in. But again, we were just overrun with the hospital protocol stories, which, we didn't anticipate getting them at all. I think in the back of our minds, we thought we're probably going to get some remdesivir. We'd heard about remdesivir hurting people to a terrible degree. So I anticipated some of those, but nothing like what we got. And again, it's such a God thing we went out. I knew we were out there for a reason, and we were out there to expose what they did in the hospitals and the terrible tragedy of the COVID shots.
Now, for those who, again, maybe weren't as awake or looking into this, maybe they're just listening to CNN the last 4 years, Dr. Hooker, what is remdesivir and why were hospitals using it, and why were people dying from it? Why were people dying? Why were the hospitals using it if it killed people? It wasn't COVID that people were dying from. It was the hospital protocol. So what is remdesivir and why? Why would they do that?
Right. Well, remdesivir is a patented drug. It is currently has patent protection. It is produced by the company Gilead Sciences, and Gilead Sciences collaborated with the National Institutes for Allergies and Infectious Diseases, that's Tony Fauci's agency right there, for the development of this particular drug. It was used originally in a trial against Ebola. And in the trial, it actually performed worse than any of the other drugs that were tried to combat Ebola. In fact, in that arm of the trial, when patients were given remdesivir, they died. The overall cohort that was given remdesivir, over 50%, I believe 53% of the patients ended up dying, as compared to the most effective drug where the number of patients that died was around 30%. And so it failed Ebola. And then Tony Fauci decided, let's go ahead and repurpose this drug and we'll try it against SARS-CoV-2 or COVID-19. It did not perform well. In fact, It was known from the previous clinical trial that it was causing significant organ damage, especially in the concentrations that it was given, but yet it was approved anyway. It was approved under emergency use authorization, and it was approved over and against drugs that were not on patent. You know, if you followed COVID-19 and the pandemic, you've heard something of ivermectin or hydroxychloroquine. These were front-runner drugs that were actually quite effective against the virus, especially when they were given very, very early on. But the only difference between hydroxychloroquine and ivermectin is that these are well-established drugs. They're not on patent. They are not moneymakers. But you bet remdesivir was a blockbuster, and the hospitals, when they were able to administer it, were able to gain an additional $3,000 per patient because of using this particular premium on patent drug. It made absolutely no sense to use it. It was not effective against COVID-19, but it was Tony Fauci's shiny object. And so that's what got approved by the emergency use authorization. And then it was made a part of the hospital protocol. It is an injectable, not an oral drug. And even its administration made absolutely no sense, because you don't give people antiviral drugs, late in the infection. They are absolutely not effective. Antivirals make no difference if they're given, after 72 hours after the onset of the infection. But yet they were giving these patients remdesivir for, days, weeks after the infection had occurred, and they were given multiple rounds of remdesivir, and consequently it caused their organs to shut down.
I went to the hospital about day 9 of having COVID. Now I had just given birth and my daughter had died during childbirth, so I was also intensely grieving, and my blood pressure dropped. So this was like a week before, but my blood pressure dropped so low and my oxygen dropped, and my doctor said, well, you need to go in and get scanned because of birth, not because of COVID, because I didn't really have a lot of symptoms other than I'd had a fever. I had a tiny, tiny little cough, but I was finding it a little hard to breathe. And then that hard to breathe got worse, almost like an asthma attack. And they said, listen, you're postpartum. It's likely that it could be an embolism, or it could be a clot basically in your lungs. And that's why they sent me to the hospital. So I went to the hospital, I got scanned, no clots in the lungs, we're good. And I'm on the table in the emergency room, and I'm on oxygen, and my O2 kind of leveled out, my blood pressure came back. It wasn't, I wasn't under life-threatening, but I was feeling so just scared because, again, I just lost my daughter. I'm in the hospital, and the fear about possibly dying. I was dealing with a lot of emotion. And they come in and they hand me these papers, and they go, and it wasn't remdesivir, and I wish I could remember the name of it, but it was something like it. And there was 2 different drugs they wanted to give me that was an antiviral, and it was an emergency use authorization approved, but it had never gone to human trials. It was basically the people in the hospital were the human trial.
Right.
And they hand me these just 2 pieces of paper, and they're like, hey, we really, really think you should be given your current situation, given your stats, given the fact that, your blood pressure and all that, like all the stats, we think this is life and death, and you should take this and we're going to administer it. It's an IV. You'd stay in the hospital. And I knew, I'd heard the stories already, because this was mid-April 2021, and I knew I'd heard the stories about what they'd been doing in the hospitals and putting people on ventilators and killing them with remdesivir, but I'd never heard of this drug, and so I'm like, okay, well, I'm going to look into it. Like every fiber in my being is screaming no, but at the same time, I'm also having problems breathing, and so I was like, is there anything you could give me, guys? Can you just give me something to help me breathe while I get through this? And so I read the pieces of paper. It's like, oh, this is so good. We're having really great results with this in the hospitals. And I text my midwife, and her and I, it's like 2 a.m. She's up with me, and both of us are researching this. She's on her computer, I'm on my phone, and I go to you always go to the manufacturer's website to read to get the truth, get the test, get the full list of side effects. Well, I went in and I had to dig, and I found that in the hospitals, I had what they did was they compared people in the hospitals with COVID. So God knows what they were doing to those people. They would probably put them on remdesivir. But people who were on these drugs versus people who were not on these drugs and doing something else. And the people that were on these drugs that they wanted to give me, higher risk of dying. So both groups had COVID, but it was like going for the standard hospital procedure or take these drugs. And it was more people were dying. And I found that one statistic and I showed that to the doctor. And I'm like, you're telling me that you're recommending this to people and it's clear as day. And they were getting a kickback.
Right.
They were getting a kickback because they were entering their hospital and their patients into this trial. Right. And I showed them where it said on that website, and it showed I would have a greater risk of dying. I basically have a greater risk of living if I just leave now and go home. And I hadn't been admitted yet. I was still in the ER. And so I said, is there anything you can help me with? I just need to, help with breathing. And they gave me an inhaler, albuterol.
Right.
Not prescribed to me. They did not prescribe it. They gave it to me under the table. They did not put it in any of my paperwork. It is not on my file. They handed it to me and they said, okay, get out. And it helped immediately. I took a few puffs. It helped me breathe. I was like, and I've never had asthma before, but I was like, that's what I thought it felt like. So I went home. I kept checking my stats. My stats, got better.
Right.
About a day and a half later, they call me, the hospital. I'm sitting up with my son. We're doing something. I'm feeling a lot better. I'm recovering, but feeling a lot better. Continue to check my O2. Everything's, looking good. And I still have to be on the inhaler every 4 hours because I'm, just still recovering from it. And they call and they say, we really need you to come back and get on that virus or antiviral because we are so worried about you based on your, all your stats. We're so worried about you. And I said, it's been like a day and a half. I'm sitting up and playing with my son. Like, I'm fine. I'm fine. I'm checking my oxygen. And they're like, no, really, we're worried you're going to die. You got to come back in. I'm like, die of what? Die of what? So I saw a bit of the trickery.
Exactly. And that was so prevalent. See, you've got a hospital system that they shut the country down. The country gets shut down. People are not going to the hospital. People are not using medical services. So then the hospital is starved for money. And then all of a sudden, when the hospital is opened back up, then they're scrappy and they're getting incentivized for these therapies that do not work, that are not effective. Even the World Health Organization came out and said that remdesivir was not appropriate for COVID-19 infections, but yet in the U.S., because of Tony Fauci, because of the NIAID, because of Gilead Sciences, and then because of hospitals, knowing that they were going to get premiums from insurance, from Medicaid, from Medicare, if they use remdesivir, then it was very callous, it was very calculated, but it was the hospitals and the hospital administrators making money because they had been starved of money before, so they were making money so they could keep their doors open.
I loved how well, Polly, you guys covered this in the documentary. I really want everyone to make sure they go watch your documentary because it was outlined so well how the hospitals, first of all, like you'd said, Dr. Hooker, that they were starved for money in the first 3 months of COVID back in 2020. I know all of us, just want to forget that entire year. Right. But back in 2020, we were told not to go to the hospitals. The hospitals were empty and we were lied to. We were told they were full of people. They were empty. The hospitals, our organization. So I'm from Canada. I live in the States. I'm from Canada. So in Canada, the hospitals want to save money. So when they do procedures, they're looking to do the least expensive thing they can do, right? So they're saving money. So, people die because they're saving money. Just in Canada. Here, they died because it was a moneymaker for the hospitals. The hospitals got kickbacks. They got some at $40,000+ to basically kill a patient. But again, this is where people are listening, and even part of me is like, but those doctors aren't Satanists. There's those doctors are the nurses and the doctors are good people. Why would they kill patient after patient every day? You hear these nurses say, we had patients every single day die from these protocols, day after day after day after day, and it was like a factory farm turning over body after body, day after day, doing giving them the drugs that they knew would kill them. Sometimes 30 drugs that they would give these people without the permission of the family, and the family wasn't allowed to even come into the hospital. So the hospitals were in who was at the head of the hospital deciding to murder people for money? Really?
That's a really good question. We saw that there was a level of contempt against the unvaccinated once they were into the hospitals. And so, and there were even, comments by healthcare professionals, doctors, nurses saying, well, you're only getting what you deserve because you wouldn't, take the vaccine, you wouldn't save grandma, you wouldn't, do your bit for society. So therefore you are, I have no compassion for you. You're getting what you absolutely deserved. And, in those instances, it was absolutely chilling, the level of callousness, the level of hubris of these medical professionals that they would end up depriving people's lives. If these people were resisting against the hospital protocol, some of them were put in 4-point restraints. Some of them then were given a cocktail of narcotic drugs, like fentanyl and morphine and propofol. So they were basically paralyzed, laying there, dying from these hospital protocols.
Polly, do any stories stand out to you? You interviewed over 1,000 people for the documentary and traveled to so many cities, but is there any story or stories that you want to share?
I mean, there are so many, and there's no ones that, if you like, on my favorite, because it was also very sad. But there's one girl that I did get very sad about. So this girl was at college, so she was around 18 or 19 years old, and she was unvaccinated all her life. Her mother brought her up to be completely vaccine free, and holistically brought up. And this girl called her mother and said, look, and the mother was the one telling the story. She said, look, Mum, I'm gonna take the COVID shot. I know you're not gonna like it, but I can't deal with the abuse of everyone in my college. I'm not allowed to do anything. I'm not allowed to go out. I want to go to this concert. I can't do anything, and I'm just being abused because everyone else has taken the shot. So she took the shot, and her injury was so severe. Anyway, she died. And the mother was sitting there with her only daughter telling us, she was called Rachel, this girl, and we've got a picture of her on the bus. To me, it was so tragic. It was so tragic that this girl knew the vaccine was not a good thing, but she just couldn't cope with the peer pressure. And there are other stories like that, but it was just a very sad situation. And of course, all the hospital protocols, I mean, as Brian said, it was very difficult to listen to the abuse going on in the hospital. So when you say, or people say, but doctors and nurses are good, look, there's good people and there are people that are not so good. And that includes doctors and nurses as well. And the reports of the abuse from those that were in the hospital is very difficult to understand, that a human being can treat someone like that. It was like they were possessed, and they were blaming them for being unvaccinated. This is what you get. This is what you deserve because you did not trust us and take the shot. So this is what you get. Everybody look at these people. They're unvaccinated, so they will die. And it was the same message over and over again. So I don't believe that you can say that the doctors didn't know. I think, how can you not know? How can you not know when they are dying in front of you and dying filthy deaths? When the loved ones were allowed to go and say goodbye, and many of them missed the goodbye window, They would say that they would be covered in their own feces and their hair was all matted. They were covered in bed sores. These people had water taken away from them, food taken away from them. They were starved and they were given 4-point restraints and held down until they died. So they don't get a pass from me. You people that were involved in that, you have blood on your hands and you need to come forward right now and tell us what happened and repent, because that's the only way you're going to get out of this.
I was surprised at how many the loved ones who came on your bus said over, like it was wild. You edited it in a really good way to show. They said almost the same thing. Like it was the same story. And it wasn't just one hospital. You traveled across America. It was hospital after hospital said the same thing, that they refused to give the patients water. And some of them refused to give them food and water. And for days, sometimes 12 days, no water. Of course they died. Of course they died. Of course, kidney disease. Of course they died of kidney failure. They were not given, I mean, yes, we know remdesivir does that. But on top of all that, they refused to give them water.
That's right.
Like, this is, I mean, the Nuremberg Code, right? How many times, and I have seen the Nuremberg Code be violated. His human rights were violated over and over and over again from these different organizations. It's sick.
And they would say, it's the protocol. When loved ones would call up the hospital and say, my husband or whatever is desperate for just some ice chips. Please, oh no, it's the protocol. He can't have them. What protocol? That's ridiculous. We all know that when you're sick, the first thing you do is hydrate yourself, no matter even what the sickness is.
Right.
Your website for people to see the documentary, I really want them to see it. So when they go to their website, can they purchase a documentary? How can people watch the documentary?
Well, it's thanks to Children's Health Defense. This documentary is completely free. There is no way that Children's Health Defense were going to charge for the people's stories. So I'm so proud of them that they've gone out there and some people have donated anyway, which is really wonderful because we can make more films. But it's free. Go to chd.tv and it's right there in front of you. And we have a movie section where Vaxxed 2 is also in that movie section. And every single show that you watch or movie that you watch is completely free. Because we want to educate and get this message out. I mean, we cannot allow this to happen again. And the only way that we can stop this is if we collectively come together, keep educating ourselves the whole time. And the best education is from the people to the people. You can't trust the media. You definitely can't trust the politicians. You cannot trust the doctors. And you know what? Most of the institutions, schools and things like that, you can't trust these people right now. So we have to bond together as a team and fight and make sure that, because they're going to try and do this again. So we make sure it doesn't happen.
Exactly. The thing is they ramped it up, but they've actually always been doing it. And I use this as one example. Flu season. When I was a child, I'm 44 years old, so not that old, but old enough to have been around the block a few times. We didn't have a thing called flu season. That wasn't a thing. We didn't call it flu season. I haven't gone into the research to find out when this became a term, but I have a suspicion it was around the late 90s when they really started ramping up and coming out with flu shots.
Right.
And you know what? I took a flu shot once with my mom. And my mom was a holistic, very natural-minded person, but we went to our chiropractic office of all places, and our chiropractor at the time was so excited to offer us this new thing. Again, being Canadian, our vaccine schedule was different from America. I don't know when flu shots, maybe you could tell us, Dr. Hooker, if you remember when flu shots started to become a really thing, when they started ramping it up, but they started advertising it, right? And that's another whole thing to get into, is when they started advertising pharmaceuticals, because that used to be illegal until they pushed being able to advertise birth control. And once that opened up the floodgates, then pharmaceuticals, and this is at least in Canada, I remember we went one day, zero anything from the pharmaceutical companies on commercials to, 2/3 of the commercials are pharmaceuticals. But we all of a sudden started calling it flu season, right? Now,
Sure.
why do people, why do people get more sick in the winter than in the summer? I know people in the summer that got the flu. So don't tell me that it can't be caught in the summer. But yeah, okay, we're indoors more, we're exposed to each other more, we have less vitamin D, less sunlight. Here's the thing. I didn't see it as a kid, but it happened to me. I was 13 years old. I was rebelling from my mom and her healthy ways. We had no junk food in the house ever. It was my last time doing trick-or-treating. I went with my friends and we got a huge, huge bag of candy. I ate all of it. And then I ate, just all the Halloween kind of stuff. And I ate so much sugar, I got an infection. I had never been on a drug in my life. I'd never been on a prescription in my life. I was 13 years old and I got on my first course of antibiotics. And I was on antibiotics from then until Christmas because I couldn't kick the infection. And I had been eating sugar non-stop. It isn't flu season, it's sugar season. Kids eat
absolutely.
the Halloween candy, the Thanksgiving, Christmas, New Year's, and then again in Valentine's Day. It is sugar season, and sugar shuts down the immune system. And then they go take a flu shot. It'll prevent it. It doesn't. It makes it worse, not better. So that was my big aha moment because my mom and I took it once. It was 1999. We both got sick as dogs for 2 weeks after that. And we both went, oh, flu shots hurt you. They don't help. They hurt. We're never doing that again. And that was I started to wake up at that point, started to question. And that's what I love that your documentaries, this one is amazing. And all three of them are amazing. I love your documentaries are bringing the truth because this truth is suppressed. I know I can't publish this episode on YouTube. It will be taken down. All those episodes I had mentioned, including I hadn't mentioned episode 461 with Dr. Paul Thomas. That's a really good one to listen to also, especially for parents who are vaccinating or thinking about vaccinating. Listen to that pediatrician, Dr. Paul Thomas, episode 461. You have to know what he uncovers from years of being a pediatrician and to the every single child whose vaccine is injured in some way, and he proves it. And it is mind blowing. So tell us a bit about the Children's Health Defense, because honestly, it hadn't been on my radar until recently on X, former Twitter. My husband sent me a link, said you have to see this woman, and it was in the last 2 months. This young girl goes to a hospital in California. She has a rare blood disorder and she wants to get a treatment. And the doctor says, well, before you do, you have to get caught up on all your vaccines. Right. And it almost killed her. And that's when I really started learning about the Children's Health Defense, because they come to her aid. Polly, I know, Polly, you were advocating for her. I saw your live videos with her. Maybe could you talk a bit about that? And that's why I started falling in love with Children's Health Defense, because you guys are actively helping parents and children who get vaccine injured or who are in active vaccine injury and who are dying in the hospitals because the doctors do not know the protocols to save someone when they're in an active event where their body is shutting down.
Yeah, well, we were fortunate enough to be contacted by a nurse who was going down to help Alexis. And we managed to go live and report it as it was happening. And there's nothing, if anyone listening is ever in a situation like that, do contact us, because when you've got eyes on something, then they back off. So I think it helps a lot. But Brian, you know a lot about this story as well.
Right.
So maybe you want to take it from here.
Well, it's such a horrific story. Alexis Lorenz and her family down in Orange County, California. She has a genetic disorder. It's a genetic disorder that was caused by a spontaneous mutation in her early adulthood, where she actually, when she flares, she can make antibodies to her own hemoglobin. Ooh. Okay, and so she, in order to take this drug, she was having head pain, and the head pain they thought was attributable to this disorder. But in order to then treat her, they were going to treat her with a drug called Soliris. And when you take Soliris, it is recommended that you get the meningococcal vaccine, and actually for meningococcal meningitis A and then meningococcal meningitis B. And so the hospital insisted that she go ahead and get the vaccinations. They also included, and I still haven't figured this one out, the Haemophilus influenza B, or the Hib vaccine. She ended up getting that as well. And so she ends up getting 3 vaccines in one visit. And within 10 minutes, she has tremendous head pain. She was going through a really, really strong encephalopathy, encephalitis, brain swelling. And so she's having this tremendous pain. She's yelling, she's screaming out within 10 minutes of vaccination, and trying to get the attention of the hospital workers at that point in time, unsuccessfully. And then she starts bruising uncontrollably. And she ended up with a disorder called thrombotic thrombocytopenia purpura, excuse me. And it basically was an exaggeration of an immune response. It was an immediate autoimmune response that caused the antibodies to attack her blood cell components. That there were actually antibodies that were causing her blood to clot. There were antibodies causing the red cells to dysfunction, and antibodies rushing into these sites, causing the integrity of her vessel walls to fail. So she started to get this bruising. And she was, she very well could have died of this disorder, TTP. And if it hadn't been for them, actually, it was almost accidentally, they started to give her blood transfusions. What they needed to do was they needed to get the antibodies out of her plasma. They did not do that. They instead of getting the antibodies out of her plasma, they gave her blood transfusions. But just that act of transfusing caused the autoimmune reaction to calm down. But in the process of all of this bruising, all of this damage done to the circulatory system, then now she's, it's almost like she's a burn victim. It looks like she's got 3rd-degree burns, all over her skin. She's going to have grafts, all over her head area, her forehead, other places in her body, her neck. Is just an absolute mess. And the hospital would denied up and down that was a vaccine adverse event, even though it started, frankly, 10 minutes after she received those 3 vaccines.
They still deny it?
They still deny it. And she never should have gotten those vaccines together. Even if they were going to vaccinate her, it was wholly irresponsible that they would give her 3 vaccines with her disorder, with her autoimmune disorder already, for them to sit down and to give her 3 vaccines. It was basically a death sentence.
And I've seen the videos, and it's worth going and checking it out. How can people follow this story, follow her when they go on X, or can they? Is it on the Children's Health Defense?
You can. Yeah. Go ahead, Polly.
Well, we have all the videos. If you go to X, Children's Health Defense, there you will find them there. But also, it might be easier because we post so much on Twitter, or X as it's called. Go to chd.tv and just put Alexis' name in, and you'll find all of the lives there. It's really easy to find. And
yeah, the story that was unfolding was, at first the doctors were saying, "Don't film us, don't film this." They were trying to suppress her from going live, but she was going live and live streaming and saying, "Guys, I can't see." She lost vision. She was alone, young girl in her early 20s, alone in a hospital, and they were ignoring her, and the doctors were saying, "Stop filming, don't go live." And thank God, I'm so grateful God was there for her that day, and God answers our prayers by connecting us with each other. And so you guys came to her aid, and that wonderful nurse came to her aid.
Angela, yeah, she's amazing.
and it's because and then the hospital started listening to her and the nurse who was working with the other doctors that she knows that who are aware of what to do in these instances, started to give her like with steroids, or started to give her what she needed to
Right.
calm it down.
Yeah, steroids. She was on prednisone for a while, and they tapered that off. At one point, they were taping her and get it off too quickly, and so she ended up in sort of a crisis situation. But again, I'm glad. I got a call from Nurse Angela. I think that she called. I'm not an MD, but she called me just for advice. From a biochemical standpoint, she called practitioners, and people really reached out. And you can follow Alexis if you just go to X and type in Alexis Lorenz. She posts on a regular basis of her progress. And Lorenz is Lorenze. So you can follow her on CHD TV. You can also follow her directly on X. And she does need our prayers. She's not out of the woods. She does need our support. And, regardless, she's going to have a long, long journey. And I'm so thankful for her bravery, because she's been very, very vocal and very, very forthright with what actually happened to her.
Yep.
There's a saying that medicine is like allopathic drug-based, prescription-based medicine is the third leading cause of death, and that's using drugs as intended, as prescribed, not off-label.
Correct.
Can you speak to that statistic?
Yeah, it usually varies between the third and the fourth leading cause of death in the United States is iatrogenic medical. I don't want to necessarily call it medical error, but medical death is that they died due to some type of medical intervention. And I believe that it's probably much greater extent when you see how many people that have cancer that are actually dying from chemo drugs.
Yes.
From the use of chemo drugs, from the misadministration of chemo drugs. One of our heroes in the movement, Dr. Jim Meehan, was diagnosed with tongue cancer and esophageal cancer, and unfortunately passed away several months ago. But now his wife, Kathy Meehan, is being very forthright and frank that he didn't really die from cancer; he died from chemo. So there's a lot of things that go into that type of death, that medically associated or medically initiated death, that are not being reported. So I think that, you see it as the third leading cause of death or the fourth leading cause of death. I do think it's much worse.
But it's not just a lot of times people go, oh, well, those are like, mistakes, like medical mistakes. But what's
No.
wrapped up in those numbers are, you go to your doctor gives you a prescription. It's the right dose. It was the prescription that was, in alignment with your health condition.
Right.
And you die. And the death is from the prescription. And those prescriptions are still on the market. We have to remember that every drug that's been approved, every drug that's been removed from the market for killing too many people was first approved. That's my mom. My mom died that way. She died
Right.
of a drug that was approved, that was put on the market after it was approved, killed too many people, and then they took it off the market. And that is, we have to see that the way they practice medicine, you are more likely to die from getting the medicine than from doing nothing at all. Like when we look at the statistics, of course, if you need antibiotic, emergency medicine, of course, I want you to live.
Sure.
But when it comes to chronic disease and using these drugs, it is not safe. It's not safe. There's no safe and effective drug. All of them, there's a risk.
Absolutely. There's always a risk associated with it. And one of the things that is very, very difficult to deal with is that many, if not most, of the vaccine manufacturers are really serial felons. I mean, if you look at companies like Merck, And one of the acronyms for the HPV vaccine is Help Pay for Vioxx, and Merck killed, murdered countless tens, hundreds of thousands of people due to the use of Vioxx. And they covered that up. They covered up those murders. And, all of a sudden on the heels of that, they come out with the HPV vaccine. Well, if you have a drug company that is a serial felon, that they continue to cover up the fact that their drugs are killing people, then why should we trust them in the first place?
Exactly. They came out with the who died of chickenpox? Really, really, it's a childhood illness. Remember, we used to have chickenpox parties?
Right.
And that's still, I'm homeschooler, so that's still something that happens in the homeschool world. We've got anyone who's having wild chickenpox, not chickenpox from a vaccine shedding, but wild chickenpox, we're all going to go over and have a chickenpox party.
Right.
And that's, you have some bumps, maybe a little bit of a fever, you get to stay home and watch TV and, stay hydrated, and then it's over. But I've had amazing doctors and scientists on the show talking about the immunology of it, that as an adult, when your child, we're supposed to all have exposure to chickenpox. We're supposed to. And as an adult, when we're re-exposed, it actually tonifies the immune system and helps prevent cancer. And they've seen this with measles as well, that it helps, the tonification of the re-exposure actually lowers cancer rates. It helps tonify the immune system. So what did they do? They come out with a vaccine for chickenpox, and now they wipe out this idea of chickenpox parties, so we're not exposing our children to it. And then we get later down the road, we're getting an adult version of it, and then so they come out with another. They create a problem and then come out with a drug to fix that problem, or to quote unquote fix that problem. Can you kind of elaborate on this? That
Absolutely.
they're creating the problem and then they create the fake solution for the problem.
Well, these illnesses, these infections that were a part of a childhood growing up. I was born in 1963, so chickenpox, mumps, even measles were sort of a routine part of childhood, and now we have vaccinations, and with those vaccines, we've seen that the MMR vaccine is ineffective at preventing mumps, and so now mumps is becoming a disease of adolescents and young adults, and the consequence of having sterility associated with mumps is much, much greater now, because now it's no longer a disease in childhood, it's a disease in individuals that are, sexually maturing or sexually mature. And so, you have individuals who are rendered sterile because of getting mumps later on in life. And that is caused by the faulty immunity that wears off, it wanes precipitously into adolescence. You can say the same thing about chickenpox. Now we're getting the resurgence of children who are getting shingles. And children at younger and younger ages are now getting shingles, and it's not the children who are getting wild chickenpox infections, wild type infections or natural infections. It's the ones that are getting the vaccine that are ending up getting cases of shingles younger and younger and younger. And then you look at the measles. Well, there's a certain body of literature that shows that when you've had the measles and you've been exposed to wild type measles, then it is protective for certain forms of brain cancer. And so, these infections are not necessarily, these things that, they must be avoided. The mortality of measles before the introduction of the measles vaccine in 1963 was about 1 in 500,000. Okay, so 1 in 500,000 children in the United States were actually dying of measles, but they introduced the vaccine anyway, even though there was really no need.
Now, so we traded 1 in 500,000. What is the consequences that we get when 500,000 children are vaccinated with the MMR?
Well, one of the consequences, and I'll let Polly just speak to this directly because it directly affected her family, is autism. Absolutely, positively is autism. You take a triple live virus vaccine, 3 live viruses in a single vaccine, and oh, by the way, we don't even know how much viral particles are in the vaccine that our children are receiving because Merck has lied about that. But it ends up in catastrophe. Polly?
Yeah, it does. I mean, we lived it. But my son Billy, 27 years ago, only had the MMR. That was the only thing on the schedule then. So we knew it was that it injured our son. But nowadays, the schedule is ridiculous. That the parents have no idea which shot it was that injured, or if indeed not all of them. And then that leads me on to tell you that we did see a really different type of injury on this tour, like something we've never really seen before. So way above autism, children who can't hold their heads up, kids with polio symptoms with trachs in their necks and being fed through feeding tubes. We are really brain injuring and killing these kids like never before. And so Children's Health Defense in 2025 are going to make this one of their main missions, is to really expose this childhood schedule and take it down, because we cannot continue like we are now. The kids are dying. But pregnant mothers getting so many shots, their fetuses are dying, the newborns are dying, the toddlers are dying, the teenagers are dying. HPV Gardasil is one of the worst, most injurious vaccine that we have on the schedule, but they're all bad. We've had death from every single one of them. So, I wish that if I could go back in time and I could read Brian Hooker's book, the Vaxxed Unvaxxed book, Let the Science Speak. That book needs to go to every new mum immediately, or every family that's just getting married. That book has to go out, because that explains from a scientific point of view why vaccinating is a terrible idea.
I'm going to make sure the link to that book, by the way, is in the show notes of today's podcast at learnthroughout.com, as well as the links that we've been discussing. Please, if your heart is called to, please donate to the Children's Health Defense. I want to continue seeing the efforts going on, these documentaries being made, these interviews happening, these people being exposed, this corruption being exposed. It's for you and your children and your grandchildren. This information is for us. And so it's by investing a donation to the Children's Health Defense, I can see that we're investing in ourselves and our children's future by investing in this organization, because you guys are going up against the juggernaut. You guys are going up against a very large evil corruption, and I believe that it's a spiritual war we're fighting. That there's demonic forces. When you look at this, when you really, really look at this, and I've watched all 3 documentaries, and the second documentary covered a lot of that Gardasil information. The first documentary uncovered a lot of that MMR information. When we look at it, and when you see there's whistleblowers that come out of these organizations like the CDC, and they come out and they say, and the FDA, and they come out and they go, my conscience can't handle it. We know that these vaccines are killing. We know that these vaccines are causing damage. The MMR, for example, when you discussed in the first Vaxxed movie, the whistleblower was uncovering that they knew the genetics of African American, or anyone from African descent, males.
Right.
What was the percentage? Can you address that? So let's say you take, we're taking a mixed culture, right? We've got Asian descent, European descent, we have African descent, right? And we take all kinds of little boys and girls, and and part of the CDC schedule, we're shooting them up left, right, and center. But some, we're led to believe, it's safe and effective for everyone. But some with different genetics actually respond much worse. Everyone is damaged. This is what, and I'm excited to read your book. Actually, Brian, I've never read your book. I'm excited to dive into it. But what Dr. Paul Thomas says, I'm gonna do it. What Dr. Paul Thomas says in episode 461 with me is he uncovers, without a shadow of a doubt, with all the science, with all the data from his own clinic, over a decade of data proves every single child who receives vaccine is injured in one way or another, and he proves it. Now, not everyone gets autism, right? And that's
Right.
where we go to genetics. Why? So it's a stressor, it's a toxin we're putting into you, and some people, genetically it's worse than others. But you guys exposed that, you helped this whistleblower expose that. The
Correct.
CDC, was it the CDC that knew
Yeah.
that young Black boys were, what was it? Was it 4 times more likely to end up having a severe vaccine injury?
3.5 times more likely to be diagnosed with autism, with full-blown autism. And that was compared to just merely delaying the vaccine until after 3 years of age.
Now, hold on, because everyone who calls us anti-vaxxers
Right.
says, and they're very angry, and they're like, their faces go red, and they're yelling, and their spit is coming out of their mouth, and they say vaccines do not cause autism. How dare you say that? So what you're telling me, the CDC knows it causes autism, that's in their own, the very papers that were brought by this whistleblower who works there in the first documentary, that these organizations admit it?
Oh, absolutely. The CDC knows very uncomfortably that vaccines cause autism, and they worked very, very diligently in order to cover that up, because they're not about children. They're about profits. They're about the fact that they buy and sell $5 billion worth of vaccines through the Vaccines for Children program every year. And so, this is, again, it's a wholly captured agency. It's captured by the pharmaceutical industry. And, we have high-level officials, the director of the National Center for Birth Defects and Developmental Disabilities ordered all of that information destroyed, all of that data regarding Black boys and autism when they got the MMR vaccine on time. That was all ordered destroyed. And if it hadn't have been with the CDC whistleblower, William Thompson, then we would have had any of that information today. It would have never made the light of day.
What's happened to him he's been
He's still at the CDC. He has made the choice to stay within the CDC. I am not in direct contact with the whistleblower any longer. He has, every now and then I'll hear rumblings that, he's going to retire. I know he's approaching retirement age, fairly quickly. So, but they essentially rewarded him for his silence. So very quickly after the whistleblower came out, they kind of tucked him back into the CDC, doing who knows what. But then he was given a retention bonus quickly after that to stay within the CDC. And they put him in a division where he can't do any real damage to the vaccination program. He's in the hepatitis C division. And within that division, there is no vaccine for hepatitis C. And so frankly, I really don't know what he does all day, but he's still at the CDC.
Have any other whistleblowers come out in the last 4 years for you guys, or to you guys?
We work with whistleblowers all the time, and different types of whistleblowers. One of the more prolific whistleblowers was a hero of mine, Dr. Judith Zimmerman from the University of Utah, and she exposed the fraud in the CDC covering up the extent of the autism epidemic. And she showed that they were not reporting cases of autism, and that the autism epidemic was actually much, much worse than what the CDC was reporting. And she ended up, they threw the book at her. They tried to bring her up on criminal charges. There was a lawsuit that she was involved with that involved the university as well as the CDC. And, but I'm so thankful for these people. I mean, Dr. Zimmerman was, she was the consummate whistleblower. And unlike Dr. Thompson, who was the whistleblower for the MMR, who tucked away back into the CDC, Dr. Zimmerman went public and stayed public with her information.
So those who aren't ex-vaxxers,
Yes.
they think, well, some vaccines are good, right? Because we would have polio. This would be like the Black Plague, Dark Ages. We'd have polio. We'd have measles. We would be like a third world country. I know that's not a politically kind term anymore. But still, this is how they think. They go, if we didn't have it, then we would be like, we would have polio left, right, and center. And just, I'm thinking about how evil Bill Gates is, in that he gives the type of polio vaccine. Polio, there's no polio there was no live polio in Africa until Bill Gates came around, and he gives them the vaccine that actually sheds. So now they have polio in Africa because of his vaccine efforts. It's disgusting. Sorry, I'm going to get off my soapbox, but please talk to the people who go, well, okay, but we've gotten rid of polio with vaccines, so vaccines work, right? Vaccines are good. They've helped eradicate disease, right?
No, they never really eradicated polio in the first place. In fact, if anything, they probably caused polio to become much worse. And you look at historically, if anybody wants to find out what really happened, Google the Cutter incidents, Cutter, where the live virus vaccine sheds and created more cases of polio, more cases of paralytic polio than really had existed before. And when you look at the original polio diagnosis, I would say only 4% leads to any type of short-term paralysis, and a small fraction of 1% ever led to permanent paralysis. And so many of those polio cases also coincided with the fact that they were spraying kids directly with DDT in order to prevent lice, that they were also misdiagnosing Guillain-Barré syndrome as polio. And then people act as if this sort of paralytic disease has left. No, we have plenty of paralytic demyelinating diseases now. You always hear about what's called AFM, acute flaccid myelitis. And, so it is not that polio disappeared. It's actually was misclassified, and it's now being reclassified and sort of hiding. Then when you look at infectious polio, the vast majority of infectious polio that is anywhere in the world right now is due to the vaccine, just, directly from what you've stated regarding Bill Gates giving the live virus vaccine in Africa, in India, and then having that live virus vaccine mutate and start to spread.
So is there any vaccine that is safe to give your child?
Nope, absolutely not.
When I find one, I will let you know.
And that is where people need to take that information, and they need to go down this rabbit hole, because we have been lied to from these organizations, and it is a for-profit, not for health industry. For profit. The CDC, the fact that the CDC actually profits, that is the opposite of ethics. That is, if you want to see a definition of what is unethical, look at the CDC. It is unethical that an organization that tells us what is healthy profits from its own advice. So it has an interest in it has a monetary and political interest in the information that it puts out.
It's so lopsided. When you look at how much the CDC spends buying vaccines, over $5 billion, how much they spend promoting vaccines, $500 million, compared to what they spend on vaccine safety every year, which is about $20 million, you see how lopsided it is. It's a profit-taking enterprise. It's a money-making enterprise. And really, they could care less about safety. I mean, and you look at where the money goes, and it displays that really, really directly.
We've talked a bit about that if someone is in an adverse event in the moment, that there are protocols like steroids that they could get on. Have you seen anything that can help people recover from the long-term damages of the COVID vaccines?
I am working with several MDs on different protocols for doing that. I'm not a medical doctor myself, and so I don't necessarily endorse medical protocols. But I'm a great fan of people like Pierre Corey, who's treating long COVID vaccine injury, Paul Merrick, who's doing the same, the doctors at the FLCCC that are doing absolutely amazing work in order to detoxify the body of the effects of the spike protein, of the effects of the lipid nanoparticle, and so forth. I believe there's a lot of promise there to recover these individuals. But I think that the best advice that I would offer is that they're coming out with the boosters. They're coming to coerce you to get the boosters. Please stop getting vaccinated. Please stop getting COVID-19 boosters.
Yeah, it's not. It is so damaging, and we can see it in the VAERS.
Right.
And please go watch these documentaries. Please go to chd.tv. Watch all 3 Vaxxed documentaries. They're outstanding. Polly, congratulations. You've done such a tremendous job. It is heart-wrenching, but it is necessary. And although I cried multiple times, I couldn't stop watching. It's like we think, oh, I don't want to watch because I don't want to cry. No. You will not be able to peel your eyes away from the screen as you watch the documentary. It is so good. And it's necessary. If we want to protect ourselves and our children and our families, if we want to protect them, we have to arm ourselves with this information. So, Polly, thank you so much for the work you have done and continue to do. You're doing such an awesome job.
Well, thank you. I would love to tell your viewers about, so basically what you see in Vaxxed 3 is only a tiny smidgen of the amount of stories that we've done. We are going to run 48 hours of non-stop COVID injury stories, hospital protocol, deaths, and the people who are hurt by the COVID shots. And we're going to run them back to back for 48 hours. So it would be great if people could tune in, and because every story is important. Every story deserves to be heard.
And we learn from them because we go, hey, I keep hearing the same thing over again, or hey, that happened to me, or hey, that happened to my dad, or that happened to my mom or my husband or my kid, over and over and over again. And you are not alone. You will hear your own experiences reflected in the Vaxxed 3 documentary and in these stories. You will hear it reflected. And when we rise up and we go, we're the masses, and they're like gaslighting us, belittling us, telling us that we're stupid,
right?
And we see the truth. So thank you so much, Polly. Where can they go to watch in early December? Where can they go to watch the continuous videos? Is that on chd.tv?
It is, and if you sign up for text alerts, we'll just send you a text alert to remind you that we're about to go live. And so you get prompted to that. You'll be able to see it. But yeah, 48 hours. So around the world, we hope that everyone will watch these people's stories.
Now, we didn't talk much about who the Children's Health Defense is. It's obviously it's a nonprofit. Who are you guys?
We're an organization that was started as the World Mercury Project back in 2015. We were looking primarily at mercury in medicine then and defending the health of children against mercury in medicine. The scope of our work increased and expanded to the point where in 2018 we became the Children's Health Defense. And we were started by none other than Robert F. Kennedy Jr. Back in 2015, and he is our chairman on leave, chairman of the board of directors. Our fundamental pillars are advocacy, litigation, education, and science. And so we're using those particular vehicles in order to warn people about vaccine injury, create vaccine safety science that's never existed before, because the agencies won't do that. They do it themselves, and they certainly will not tell the truth about vaccine injury. We're involved in litigation nationwide. representing children with vaccine injury, representing cases where we have been censored and others like us have been censored for speaking out against vaccine injury, and then a whole arm to be able to educate new parents and individuals so we can make sure that we have the healthiest children possible.
Amazing. Outstanding. Get out there and vote. It's so important. I want to see Kennedy be able to have some power, and do some good. I'm so excited, so hopeful, filled with hope that we can make a difference, and that he can actually expose this corruption and correct it, because it's been happening for a long time, and we deserve better. Like every child and every parent, and Polly, like you've exposed thousands of parents coming to you crying, they either watched their child die from vaccine injury, or their child is now permanently damaged from vaccine injury. And everyone started out pro-vaccine. And then until it happened. Let's just wrap up with the VAERS, just because I think that is so in your face. You can't ignore it. What are the percentages? Like, give us some percentages of vaccine injury. And we know that it's only 1% that are actually reporting. And which you've said, people have said, hey, I had Guillain-Barré and I submitted it and it was there, and then they deleted it and they removed it from VAERS. So we know not all vaccine adverse events are even staying public. So out of the numbers that you do know, the statistics that you do know, how many people are being vaccine injured?
Well, when we look at the statistics now, just to kind of go to the first question is about 30% of all reports that are filed in VAERS never see the light of day. So we're, even those reports that are made, and that's only a small fraction of the actual number of vaccine injuries, 30% are censored and edited, and these tend to be 30% of the worst types of vaccine injuries that are being censored and withheld from the American public. If you look at the carnage of the COVID-19 shot, the last I checked VAERS, there were 1.5 million voluntary entries of COVID-19 vaccine injuries. That eclipses the entire rest of the history of VAERS. Every other vaccine put together that's ever been on the vaccination schedule since VAERS was started 32 years ago. Now with the COVID-19 shot, we have more injuries than all of that 32-year history put together. And so, this is like nothing we've seen before. If you look at the number of deaths that have been reported on the VAERS database, it's greater than all the reports of deaths for all the other vaccines put together over that 32-year history again.
That's wild.
And when you look at, then you look at things like cardiac damage, myocarditis, pericarditis, ischemic stroke, hemorrhagic stroke, heart attack. These are, starting to eclipse really the other types of injuries that are being seen on VAERS. I mean, there's so many issues with the circulatory system, because the spike protein is designed to get into circulation, and then it interacts adversely with circulatory cells. So we're starting to see those injuries eclipse everything else.
Just to think the scope that for 3 decades they collected adverse events, and it now pales in comparison to the COVID shots.
Correct.
That is so disgusting. And is it 3 shots, the 3 different companies?
Well, right now they're distributed in the United States. There's the Pfizer vaccine, there's the Moderna vaccine, and then there's the Novavax vaccine. For a while, there was the Johnson & Johnson vaccine, but it was suspended and taken off the market because of adverse events. Really none of them belong on the market. But yeah, you're absolutely right. It's the compilation of 3 different vaccines.
Thank you so much for coming on the show today, both of you, and for all the work you do. You've got targets on your back. Have you what have you felt like you guys need to order some, security or go live it in secret? Like, do you has your lives been threatened, or you're like worried your food's going to get poisoned?
No, I mean, we have faith, so Jesus is my protection. I'm good.
Okay, awesome.
I
I love
can't
it.
answer any better than that. Jesus is our protection. For a while, I was receiving harassing anonymous phone calls from the CDC, but it was actually quite humorous. I mean, once I got used to it, it was just sort of like, oh, well, hey, thanks for calling. We'll talk to you again tomorrow. It was a little it was a little inane while it was happening. It hasn't happened in quite a long time, but yeah, God's got our back.
Awesome, wonderful. Polly, is there anything you want to say to wrap up today's interviews? Anything you want to make sure that we covered?
I just would love, I wish I had known this when I first became a mum, that you, as a mother, as a father, you are ultimately in charge of your child. No pediatrician, no doctor, no scientist, no politician. You are in charge of your child. So do not be bullied. We were all bullied into fear. Fear is what drives us all to do these things. Instead of taking a step back, you are more clever than they want you to think you are. You don't need a medical degree to go and look up the insert and find out what it is they're about to put in your child. So please do your research, proper research. Turn off mainstream media and take back control of your child, because living with vaccine injury is hell. And it really is something that you do not. That's why Brian and I do what we do, because we want to stop you from going through what we are living with now. We love our boys and we're grateful that they survived the shots. But this is not how their life should be.
No, 100%.
And I too know so many families who they've either lost a loved one or their child is permanently damaged, and it is disgusting. It's unfair, and we're constantly lied to, and this is why we have to take charge. And that insert you talked about is not what the doctor prints out and hands to you. It is actually this long paper that is in the box with the vial, and you have to ask for that. And when you start to research each individual ingredient that's in any vaccine, if you ingested any of those, you would have to call poison control. It's disgusting, and there's carcinogenic. We just scratched the surface today, but it's turbo cancers and blood clots that are never, ever seen before. People who are the embalmers, the morticians, especially in Canada, there's a whole group of morticians who are saying, because they were really severe in Canada, that's where I'm from, they're really severe with pushing, the way they pushed the vaccines and the way they used fear. They were totally against the Nuremberg Code. And the mortician said, I've been a mortician 30 years, 40 years. Never once have I seen blood clots that were this way. It's a new thing we have never seen in humans before. And that's from the COVID vaccines, that we have these horrific cardiovascular events, and in death, we're seeing it as they pull out these giant long clots that are fibrous. The body just clots up. That's what happened to my best friend. And so many people know people who've been injured, especially from these. So, they overplayed their hand. They've been doing it to us for years, but they overplayed their hand. And now you guys are exposing them. And we need to share this information. Please, please, please share Children's Health Defense website, the chd.tv, with those you care about, with those who have children or going to have children, with grandmas, with grandpas, with uncles, aunts, everyone. Please, please, please share that link. Tell them, go watch this with an open mind. You know what? If someone is not willing to even, those anti-vaxxers, I'm not going to watch that. If someone's not willing to watch it, you have to say, do you have a belief system that is grounded in science, or do you have dogma? Because if you're not willing to look at the other side with an open mind, then you don't have a belief system. You have dogma. You don't have an educated based belief system. So we have to help people because so many children are dying or suffering needlessly. So thank you for the work that you guys are doing. Everyone's got to go see the Vaxxed the third Vaxxed documentary, but really all three. And I so appreciate you guys. I'd love to have you back on the show. Please come back when you have more to share. I'd be so honored to have you back.
Thank you for having us.
Absolutely. Thank you so much.
Are you tired of guessing your way through supplements? Feeling like each choice is just another shot in the dark? Unlock your health potential at takeyoursupplements.com. Here, we don't just sell supplements, we customize wellness. Connect with a true health coach who tailors your nutritional path based on your unique health goals and challenges. From fatigue to vitality, from confusion to clarity. Start your transformation today. Visit takeyoursupplements.com and discover how feeling amazing is just one free consultation away. That's takeyoursupplements.com.